Welcome, everyone. My name is Natalie Freeman, and I'm with Foothold Technology. Today's webinar is Adapting to Change, Tips for Surviving and Thriving in an Ever-Changing Landscape. I'd like to start by thanking both Frank Kerber, who's co-presenting with Foothold's David Bucciferro, and PAR, who we have partnered with on this webinar. We have a lot of information to get through today, but we'd like to answer as many questions as possible. If you have a question at any point during the presentation, please let me know by sending a chat message to Foothold Technology. And now I'm going to pass it over to David.
You just have to share. So give me sharing.
You should have it now.
Okay, can everybody see my screen okay?
I can see it.
Natalie? Okay, great. I'm sorry I went forward too quickly. Okay, everybody, thanks for joining. My pleasure to be here today with you folks, especially when the NCAA tournament's going on, and I know many of you may have other places you'd rather be, like in front of a computer screen watching the TV game. But we're going to cover a lot of information today. Hopefully, much of what we talk about will be things that pertain to the different areas that you do within your job every day. And Frank and I are going to bounce back and forth, giving you some information and then sharing some, personal pieces about how this information, benefits us or how we've used it before, and open up that if you folks have questions, please feel free at any point in time to just type them in the chat box, and Natalie will convey to us that there's a question, and we will stop and answer them. So I'm going to start by just doing a little quick piece about the landscape today. And it really, I use this slide in a number of different types of presentations because it really just sort of conveys that message of everything people are going through, and it really fits regardless of where you are within the system of healthcare. Doesn't really matter the group that you're dealing with. It doesn't really matter the type of program you are, because all of these things are things that you're all facing today. And, things such as the value-based care and funding changes, coding changes, for some Olmstead Act, for others privacy and consent concerns. In some places, there's new waiver rules that are taking place, which change regulations, which change rates, which change the approach that we need to do. There's, needless to say, a lot of uncertainty in the federal direction and where things are going. And at the state and local levels, there's a lot of financial instability in many communities that adversely affects their ability to generate revenue for programs. So you as a provider are facing a number of different things in a number of different ways. And before I jump in, I wanted to share with you, last week I'm a co-chair of a national opioid epidemic committee that is put together of individuals that have behavioral health backgrounds and technology backgrounds, and we met with a number of different groups last week, the Congressional Leaders Group that are working on opioid epidemic and dealing with the White House group that is dealing with trying to use technology for opioid epidemic stemming, and a number of different people involved. And the interesting piece that came out of it, besides the fact that this is an unprecedented groups of people that are working together, regardless of party, regardless of where the organization stands, is the use of data and how they're looking at data as a critical piece to trying to fix the problem that exists, or at least be able to stem this epidemic and try to focus energy in places in which prevention and clinical care can really help. And I think part of what we're going to talk about today, this concept of using data, is hopefully going to resonate with you, similar to it, the way it resonated with me as I was, participating in this work group. And so, I'm just going to start. I'm not going to go through all of these, but needless to say, healthcare focus in this country has changed. Whether it be the triple aim that started it, whether it be the expansion that happened during the Affordable Care Act within Medicaid, maybe it's the behavioral health parity, but needless to say, there's been a change in the healthcare focus. Groups that once were in a silo that dealt with whether it be developmentally disabled individuals or behavioral health people, mental health or substance abuse, whether it be elderly that were in home care situations, the way that individuals are served, the way in which information on those individuals is used to make decisions has changed. The concept of the person being in the center of their care has never been stronger. The idea of sharing information with individuals so that you can promote wellness and act in preventative ways and really prevent those relapses that happen upstream where individuals end up in a very high level of care that costs the system, quite honestly, a lot of money. And most recently, the idea of looking at the social determinants of health when we're looking at how individuals with disabilities, and again, it crosses all disabilities, are going to recover and are going to be able to be participating in a community living situation. There's obviously a lot of changes that take place. It really is going to depend upon where you are and how you look at things to really determine why we're having so many of these changes. To some, it's solely about controlling costs. And it's hard to argue that because there's been a lot of efforts in recent years to really look at costs and try to control them. For others, it's around the quality control of the way services are delivered. To some, it's really a platform. It's a new way that we can incorporate practices and clinical pathway work and clinical decision-making software that can really help in providing better services to a greater number of people. Regardless of what it is we're doing, the concept of creating efficiencies is a major part of what's happening. And the big thing that we gear ourselves towards right now, and again, this doesn't matter where you are in the healthcare field, physical health or disability health, it's going to be around value-based payments. Every component of the healthcare system is going to be touched by value-based payments. Probably more than any other initiative touched people, other than maybe the Affordable Care Act. The concept behind value-based payments is going to have an effect on the way you do business. And there's different ways people look at this, and for the most part, I would say I'm not wrong in saying that there's a lot of fear out there. Fear that you're not going to be able to do business the way you've always done it. And honestly, that's true. And honestly, a lot of the changes that are being made are targeted upon that. It's around fears that the rates that people are going to be willing to pay for the amount of work they want you to do are not going to be adequate. There's fear that the people we serve are not going to receive all the services they need to receive because there's going to be someone else coordinating that level of care, and not you, the person who for all these years have worked with somebody. we know there's going to be unfunded mandates. There always are. I happen to be a school board president in my community in addition to my regular life of work, and we talk about this concept all the time, unfunded mandates, and it crosses all the kinds of work that we do, that there's mandates frequently that are just unfunded, and oftentimes, looked at and, well, this is what you should be doing, when people don't realize all the necessary work that you have to do on a daily basis. And all of this, regardless of what it is, creates increased administrative burdens. So before I jump in and ask Frank if he wants to add anything, I just go through these little concepts. When you're dealing with change, there's a lot of change strategies that people use. I sort of look at steps that I can do to try to help me deal with change and how change is happening. One of them is to be proactive, to be very involved, to not wait until change affects me, but to be ready for that change, to be involved in that change, and to try to help as much as possible to really direct what that change is going to be. And that really involves attending a lot of meetings. It involves meeting with government officials. We didn't go through who we were, but for those of you who may not know, my career started, I had a 32-year career in government as a director and an administrator in the behavioral health field, in which I worked with individuals with developmental disabilities, with substance abuse and mental health issues. And I used to welcome when stakeholders, when providers would reach out to me and share with me their thoughts about what changes were being thought of, because it allowed me to make those kinds of insights into the project I never would have had. Another thing is try not to get sucked into the negativity of change. It's very easy to just, change is here, it's going to be bad. And the reality is that doesn't help anyone. It doesn't help you for sure, and it doesn't help those individuals who work for you or with you on a daily basis. So rather try to look at the positive aspects, as few as they may be or whatever they may be, and to really direct questions about those aspects to the right person. One thing that happens at times when there's changes in communities and times of changes within healthcare in general is that there's a lot of different rumors that go around, or a lot of different stories, and they can cause a lot of trouble if they're not dealt with really quickly. And, this person heard from that person that this is what the state said, and then that person shared it with another, and then the next thing you know, there's this circle of misinformation getting worse every level. And so I would really encourage you that if you have a question, look to people who either have connection with those authorities or are those authorities in themselves. And no matter what, don't give up, because the sun always shines the next day. You're going to deal with this change in one way or another. Don't give in to the negativity of that change. And really, my last point, and really the point we're going to talk mostly about, although we're going to go through a few other pieces, is that the best way to deal with change is with information. And that means using data, that most of which you have at your fingertips today, in a different way. Frank, anything you'd like to add? Or
No, a lot of the things that you've said are really resonating with me. I go back even to the very first slide in talking about government involvement, and they're all kind of pushing us, all the different systems, to work together and be much more efficient in providing information and using that information to provide better quality of care. So I think you're right on with what you're saying.
Good. I got to participate in a small group that met with the CMS administrator, Seema Verma, last week, and Frank, that's one thing she really stressed was if there's one thing that CMS is looking to do in the next 18 months or less, it's really to ensure that people are working together, that providers are working together, that information is being shared, that individuals no longer have to be concerned that they may have gone to the doctor on Tuesday and the test that took place at that doctor would not be in the hands of another practitioner they were seeing on Thursday. That would be information that would be at the fingertips for practitioners to be able to use in making clinical decisions. And I think that integration of care and that the government really looking at different aspects of healthcare in a different way. You know, I think there's significantly more value now to the work you folks all do than I think people looked at in the past.
Yeah, absolutely. And the pressure we feel on our end is that information is becoming more and more available. We need to be able to act on it and do the right things with that information to ensure the outcomes.
Great. Thanks, Frank. So we're going to talk about managing change in three ways. We're going to focus mostly on the data information. And Natalie's going to make sure that everyone who participates in this call is given these slides, because from a time perspective, I'm not going to be able, I don't really want to spend a really long time around the quality leadership piece, because most of you are leaders anyways, and most of you are good leaders. We're also going to talk a little bit about the quality workforce. There's some pieces of that I think are valuable to look at. But as I said, data and information will be the primary focus of what we talk about. But let's touch upon leadership for a second. I think these three pieces in this kind of a format really sort of lay out an idea of agency change and how an agency has to look at, I've got to do business differently now because of A, B, C, or D, or E, whatever's happening. Sometimes these are things that happen directly to you as an agency. In my time with the state, I've seen things such as a provider closes and we look at another provider and say, we want you to incorporate these services into your program, from a geographic perspective or from a quality perspective, and it really makes for a major change in that agency. In other cases, it's because of regulations, or it's because of new programming. In other cases, it's because of funding changes. And so leadership, data, and workforce are three of the most critical pieces. And I put data in the middle for a reason, really because it both informs leadership and it's a tool for the workforce. And so let's just touch upon a little bit upon some of these leadership strategies. And I'm expecting that most of these are not going to be new to a lot of you. There's been a lot written about leadership over the years. I will tell you that I think some of the best work around leadership is really the new stuff, because it really now takes the idea of data-based management, of informational-based management, and couples it with some of the older strategies around workforce leadership. Some of the ideas that came out of the work at Toyota and some of the work that was done with IBM and some of the other major companies and some of the changes they went through and some of the ideas and concepts that were generated from that idea, and then incorporates into it this idea that decisions have to be made mostly with information rather than traditional criteria that may have been used in the past. So for one thing, for any kind of change to work, the leadership has to buy into it. And the culture within an organization has to be around change management. It's really, you need to create a team that knows what has to be done. And it's not like, well, this person's in the know. No, it's got to be a team that everybody knows what's happening, and not just particular individuals being in this idea of in the know. And leadership really knows how to understand how information is going to be managed in their organization and how it's going to be used. That tone of information being important, and it helping that we know the changes that are going to be coming and we're going to be ready for them. It's really focusing on human resources and understanding the idea that regardless of where you are in an organization, what staff are involved, there has to be a unified expectation by all staff. You know, we can't look at something and say that. Oh, go ahead, Frank.
Well, I just wanted to piggyback on what you're saying, that aspect of the leadership is key, because if people don't understand why you're doing what you're doing when you're implementing new technology, there's going to be a lot more resistance. And when people I see the glimmer in people's eyes, and when they get why we're doing what we're doing, and they see the efficiencies in that, and being able to having the data and being able to do their jobs better because of it. When everybody gets that, it goes a lot smoother and a lot quicker.
That's a great point. Thanks, Frank. You know, quality assurance is another area. You know, make sure as a leader you have quality assurance protocols in place within your organization that sort of complement what government is looking for, what outcomes they're looking for, and that you, inside of your organization, have a strong feedback loop. People should look at quality improvement and quality assurance not as a punitive measure, not as we're trying to find errors that you're making, but more along the lines of we want to identify where we can improve effectiveness and efficiency through this quality assurance protocols that we have in place, not where people are not doing their job or something like that. And then lastly, all of you need to be driven by a mission, right? And that mission is critical in how you're going to integrate whatever new or whatever change is coming into place, whether it be new provisions for service delivery, whether it be new ways you're going to be doing billing, regardless of what it might be. You know, everything should be driven from that mission, and that allows you to continuously stay focused on where you need to go. So now I want to shift into really like the heart of our conversation, and that's really around using data in your agency. And again, I encourage you, if you got something to add, please feel free to jump in. If you have a question or a disagreement or anything, please drop a note in that chat box. I'd also offer up to you that at the end of today, Natalie will both be sending you the PowerPoint, but our contact, Frank and my contact information, will be up on the screen. I really do encourage people to reach out. I normally get 100% more questions after a presentation than during it, because I don't know if folks just feel more comfortable reaching out individually, but I encourage you to do that and you know, open up a conversation together about any of this information that you may have questions on, or you know, that you have comments on. So let's talk about the what. The what is really what data are we talking about, and how do we identify that information? And you know, I sort of look at it from three different perspectives. One is I need data to meet my obligations, right? Whether it be for accountability, whether it be for regulatory purposes, or whether it be for financial pieces. I have obligations to external and internal forces, and I want to make sure that I'm meeting those, you know, that I have the data for those obligations. Secondly is managing and supervision. You need data to be able to manage properly and supervise individuals. And then lastly, the only way you're going to improve performance is really having information. The next part you look at is why. It's sort of, okay, why do I need this data? And how am I going to use this data? And you know, I touched a second upon this, but you really got to meet your obligations, internal and external. You know, I say this to folks, and this used to be a line I used to tell people when I did site visits and when I had to do accreditation visits or certification work, or work with people around improving their finances in their agency. If you don't meet your obligations, whether they be financial obligations, regulatory obligations, obligations to your clients or community or your board, if you don't meet those, you're not going to be there. And so all the good work that you want to do doesn't exist because, you know, you've lapsed on your obligations. And the best way to meet those obligations is really with data. And I'll talk a little bit more about that in a minute. Also around having an informed decision-making process, you know, improving your efficiency, collaboration, which I was talking about a little bit earlier, and marketing oneself are critical pieces that this data can be used for. So let's talk a little bit in more detail around, you know, identifying the data. And the idea of going through these pieces a little bit more detailed is that I want to sort of give you some tools that you may be able to take away from today and say, you know, let's try that. Let's try this piece for the next month and see how it goes. And then maybe we'll do a little bit more of that Frank and Dave talked about. And then maybe we'll take another step, or maybe I'll give them a call and say, you know, we're doing this and this is what we're finding. That's hopefully what we can all get out of today. I worked with an agency recently, and the executive director and I presented at a conference about a year after we were working together. And he said, you know, one thing that I came away with was, I have a lot of work to do, but I have to do this one step at a time. And so one of the very first things we did was what you talked about with your meeting obligations. What we did was we really looked at everything we have to provide to government, our funders, if they're different than the government, and in most of today's world with managed care they are, and what I have to do from accreditation. Those organizations in which I either, whether it be JACO or one of the other accreditation bodies, it's important that you meet those standards of what the accreditation body is looking for. And then we have internal obligations that we have to look for. First and foremost, our main obligation are to the people we serve, right? But we also do have obligations inside our organization to board of directors. The executive director is always answering to the board of directors, or should always be answering to the board of directors. And organizations have an obligation to their staff and to others that they come in contact with, families, and all of these obligations are critical, but they're not always easy to identify. And so I put together a little tool that I encourage you to use if you can. But what it does is it sort of lays out an idea of everyone in an organization has responsibilities and has obligations. And a simple tool that I use for people is I say, share this with all your staff and have them look at these questions within the job that they do. And I don't mean just administration. I don't mean only supervisors. I don't mean only direct care staff or non-direct care staff, administrative kinds of functions. Everyone within that organization has these kinds of obligations. Sometimes it's only an obligation to each other, but that's as critical as anything else. And so this was a part of a real CEO's that I just pulled out. And I won't go through all of it, but I just want you to see that what we did was we looked at who does that individual feel like they have an accountability to what entity? You know, like a direct care staff is probably going to identify the clients they serve, their supervisor, maybe it's certain principles of their discipline that they feel very strongly with, that they have to be obligated to the practice that they're doing. Maybe it's an evidence-based practice and the obligation is to ensure that we're following that. Whatever it might be, we identify what that is. And then we look at the type of measure within that. Now, another thing that I learned in incorporating this is you can't do all of this at once. So let's say you identify 10 or 12 entities that you're accountable for. You really got to pick those 3 or 4, 2 or 3 real critical ones and focus on those first to really get an idea of how this works and how you can do this on a more global scale within your organization. But, you know, once you know the entity, you got to look at the measure. How am I going to actually show that I'm being compliant with whatever it is I need to be? You know, when I looked at outcomes and incidents and fiscal data, and then we looked at specific measures within that. You know, for outcomes, we looked at employment and hospitalization is critical. And then we looked at the frequency of that information. And I bring this up, I bring up this idea for a couple of reasons. One is it can be extremely overwhelming when you look at everything that you're obligated to and then change comes your way. And the thought is, how am I going to do this? Or what's it going to hurt in the rest of the way I do business? I can tell you with experience that if you have a handle like this chart gives you on all your obligations and how to meet them in the most efficient way, change is not going to bother you when you have to incorporate it. I want to share with you a quick little story. I did this with an agency in Tennessee. I'm sorry, in Georgia. Why I confuse Tennessee and Georgia all the time, I don't know. But in Georgia, with an agency in Atlanta, and we went through this level of detail, and we got to some administrators or some supervisor staff, and we were going through this, and they identified that there was a report that the government needed, or it wasn't really the government, it was an internal report that was needed. And we went through a whole thing, and we identified how frequently you need it. And then we got to the point where I said, okay, number one, is anybody else doing this? Because one of the purposes of what I show here is that you want to eliminate duplication of responsibility. You don't want 5 people doing the same thing. The second thing is that you want to eliminate some of the over information. Too much information is just as bad as not enough information. And so we got to that question of, okay, we need this on an annual basis, and where does it go? And they identified an email address of someone that used to be in the organization, and found out that woman had left the organization about 4 years prior, and they were still doing this report. And for no reason whatsoever other than it was just in their mind that they had to do this every year. And so it's important to constantly look at what you're doing and where you owe it. I'm just going to let you look at this on your own time, but these are really different categories. And then within each category, what would be valuable information to have.
Dave, I just wanted to jump in. That slide really resonates with what our organization is going through, because when you don't have an electronic system kind of anchors you to processes and systems. And when you don't have that, you can be torn in a lot of different directions. You're working on the urgent matters of the day, and then you forget about some of the things that you need to be reporting about and need to be looking at. And going through that process really anchors you, and then using a system keeps you honest with that, because then the day-to-day doesn't, the day-to-day can pull you away, but you always come back to this and you know what's important. So that process is a great process, I think.
Yeah, and that's a really important piece, Frank. It's, you know, our profession, our place in the world here, in what we do for a living, has always been crisis managed, right? We deal with individuals that live in crisis, or that crises happen to come up on a frequent basis. And Frank's 100% right. You need to have something that grounds you in a position where you can deal with those crises and feel comfortable that the rest of what you're supposed to be doing is moving along in the right way. Great point, Frank. Thanks.
Yeah.
And then another piece is really identifying that data that's critical. And this is really around performance improvement. And again, I'm going to, mostly let you guys go over this on your own. But these are some ideas in identifying that data. It's really target a specific area for improvement. And again, don't try to take everything on at once. Have an understanding of what indicators will show you that you're making progress. Make them far enough out so that you're not beating yourself up by saying, well, nothing's changing, nothing's changing, nothing's changing, because it takes time to have improvement in some areas. Exceed what your results are going to be. So set your baseline at places that meet standards but really allow you to grow into. And then constantly review the information. The next part of this is really around informed decision making. And, the first piece is, to me, the platform. It's the basis. It's sort of the bottom of, if you look at this from a triangle perspective or a pyramid perspective, that knowing your obligations and the information you need, it's really the base, right? You can't do the rest of what we're going to talk about without the base. And one of the most important things to do with that information you generate is to really use it in your decision-making process. Data is just data. Most of you may have some kind of an electronic system in place. For some of you it's awards. For others it might be somebody else or something else. Or you might have a Excel file that you're keeping, but it's just data, right? It doesn't really mean a whole lot. It's just data. It really becomes useful to you as you take this data and you put pieces together to inform you, to give you some information that allows you to look at a problem and feel informed about that situation. And then when you start to use that information in a way in which your decisions are based upon that information, you're really starting to reach a level of knowledge. You have a knowledge of the problem, and that knowledge is helping you to formulate what you're going to do. And then it becomes, wisdom when you actually do it. When you start making all of your decisions based upon information and knowledge, that's when you're wise. I'm often asked, because I used to work with a lot of agencies. Those of you who aren't familiar, with New York, there's well over 1,100 agencies that fall under that are within the behavioral health field. And that's not counting the additional 400 or 500 in the substance abuse area and 400 or 500 in developmental disability area. And working with those agencies, you know, I'm often asked, well, why is this ARC do better than that ARC? Or why does this psychosocial club better than that club? Or why does this association do better than that? And honestly, it comes down to a couple of things. Leadership is definitely one of them, but it's culture as well. And the culture is really around, we make our decisions based on the information we have. The world revolves too fast for us to now be able to say, well, we've always done it that way. This is the way we're going to do it again. We really use data and information to make decisions. And I found that those agencies that do that, for the most part, become more successful than others. And they do that throughout their whole organization. One thing to remember about an informed decision-making process is that it's not just the CEO's job. It's just not administration's job. It's not just the supervisors or the clinicians, but it's everybody, oversight, support. Clinicians should always be looking at information as a means to improve the way they're providing clinical services, or as a way of trying to modify or create better practices in the way they do business. Similar for supervisors who need to really use data to educate staff and to help teach staff and bring them forward and to oversee people. So it really becomes everybody's job within an organization. Now I hope that sort of, that sort of helps you sort of look at, well, we got all this data, what do we do with it? Well, you use it. Basically, you use it. First and foremost around decision. Go ahead, Frank.
Well, we're actually seeing that process begin as people. For me, a classic example is measuring progress on the treatment plan or a service plan, or whatever you want to call that plan. And without having the system automated, it's a really labor-intensive process to see overall if people are making progress or not, and then how well they're making the progress. We're finding now with the ability to generate reports and that data very easily as people figure out how to do that, they're doing that more, and then they're starting to question how well they're doing what they're doing and how well they're framing their goals and objectives. And we're seeing a kind of a metamorphosis of staff thinking on what they're doing, and we're seeing some good things happening.
That's great. You know, a number of years ago, Epic, I don't know if folks have ever heard of that. They're like the second largest electronic medical record. It's a hospital-based system. It's what many of the hospitals you go to probably use. You know, Cerner being one of the other big ones in all scripts. Those are huge hospital-based systems, you know, enterprise-based systems. And they decided they were going to do a survey a number of years ago and asked people, you know, do you do this with your system? Do you do that? Do you do this? You do that? And so what they were looking for was to try to figure out, you know, people are paying millions and millions and millions. I don't know if folks have read what the Defense Department just paid for Cerner's enterprise software, but it was in the $3.4 billion range. Are people using all the stuff that we're giving them? And what they found out was that people are using only about 11% of the information that's available to them. And there were a number of reasons for that. You know, for one thing, it was they were collecting data that wasn't necessary. That again goes back to the very first thing we talked about really identifying what you need and not collecting more than you need to meet your obligations or to do your job. Second one was that they didn't have access to the data. They didn't have access to the decision-making data they needed. And the third one was that people just, didn't think in a manner of which, I'm putting this data in, I need to get reports back out that are going to help me to do my job. And a lot of places, and hopefully this is one kind of an event for you folks that will help you to use more of the data that you have available, because you should really be up in the 70 or 80% percentile of using the data that you have, whether it's be for decision processes or meeting your obligations, and hopefully someday together we'll get to that. But one of the keys to that is really having access, the right people having access to the right parts of the information you have, and using that information on a regular basis. I worked with an agency in Long Island, and then I worked with another agency that was in California, and we set this idea that we were going to start in month one, that every meeting would have one piece of data as a focal point. And each group could decide, what that piece of information would be. Sometimes it was external, sometimes it was internal, but it always was data-based. It wasn't just story-based. So it always had to have data behind it. And then we increased that to 2. And now those agencies, 75% of all of their meetings are really reviewing data. It's looking at data and telling the story with that data. And so they regularly use that, and it makes a huge deal. And there's got to be an understanding that not all the information you need to make decisions is going to be within the privy of the software you have. That's just not always possible. At times it might come from other sources. Maybe it's a regional health information exchange, maybe it's a state, maybe it's some other kind of information base. If you're an employment program, it might come from a local labor department. But you are going to need information beyond just what you have. Make sure your reports are clear, concise, able to really be used in a manner that's not going to go outside of the work flow of a normal individual. Always review your data. There's nothing worse than making decisions on bad data. And always make sure your staff are trained. Training is a very undervalued part of staff development, and really is important. The next piece I wanted to hit upon, and I know we're starting to run a little bit tight on time, so I'm going to go through some of these pieces quickly and ask Frank to jump in wherever he feels necessary. But dynamic management is another piece of using data, and really that is a similar piece to the other. But what it allows you to do is when change hits, when something new happens to you, you don't have to wait until, well, we're going to wait till our next cycle to make this decision, because you're going to be informed, and that information is going to make you flexible, and that flexibility is going to allow you to readily adapt. And for you to be surviving in today's healthcare world, that's critical. I'm going to leave you with this. Look at it. Call me if you got a question on it. It's really this concept that was developed a number of years ago. My background, by the way, my original background before going into the behavioral health field was chemistry. And so this is sort of the idea that we lived with. Data turns into information, turns into knowledge, turns into wisdom. And I share that in our field as well. Probably the biggest thing that is happening right now in healthcare delivery is this idea around efficiencies in service delivery. The government wants 80% of the dollars by 2021, I believe it is, to be value-based, value planned out. So they would like for the dollars that are going to be paid to providers, federal dollars and state dollars, to be based upon value-based systems that are in place. And value-based systems is basically built upon this concept of efficiency. Here's a couple of areas within services where people use data to look at efficiencies. I know when you talk about efficiency, providers cringe because you guys have done so much with so little for so long, but it's still a reality. It's still something you're going to have to unfortunately live with, and they're going to be looking for more and more efficiencies in the days to come. The next piece is collaboration and interoperability, and we don't have a lot of time right now to talk about interoperability, but you know, I mentioned that I was at a conference last week of health information companies, and our CEO Marlo and I attended a number of meetings, and you know, we ran into each other after the conference and said, you know, what were your takeaways other than, you know, the focus on opioids and how significant and unprecedented that work is going to be, and the idea of clinical decision-making software and how important that's starting to become. And we both said it's interoperability. It's as healthcare becomes more complex, it's going to become more integrated. And the ability to have information, and it doesn't matter where you are. You can be the smallest developmental disability agency or the largest clinical practice in a community. Making decisions, clinical decisions, based on having a comprehensive view of an individual's health is going to be what the healthcare system is about. And having access to that information is going to be critical. And yes, it's going to trickle down. It's not going to be overnight. And it is going to affect the way we do business, because healthcare today is a collaboration. It's not a bunch of silos anymore. You know, different communities are slower than others in incorporating this, but people are really being looked at as the center of their care, and all the services around them that used to be silos in the way they looked at an individual are now going to be collaborators together for that individual. Probably last, you know, necessarily least for sure, is this idea of marketing yourself. We aren't providers, no matter what field you're in anymore. We're not in a position where we are the only provider, or we can do whatever we want because we're in that niche or we're in that silo. That day is gone. And so now you have to show your value to new people, whether it be vendors, partners, and it revolves around how effective and efficient you are. Frank, I didn't know if you wanted to add anything at that point, or?
Yeah, I think we are always looking at our data to market ourselves and looking at our outcomes, looking for the way we can use that data for grants. And we're still fairly new in the process, but as we set up the system, we're looking at that. And we also need to look at that when we share information and we collaborate with others. Having the right information, we're actually just going through that right now with one of our physicians, making sure that we have the right information, because we don't always get it properly, and communicating with those other providers is, and understanding what they're telling us is key, and then recording it properly in our record.
Great point. And you know, and honestly, you know, I think one of the things that we do is that's my life here at Foothold. So any way I can help any of you with trying to take any of these concepts and materializing them within your own organization, I'm more than happy, and we're more than happy to help you folks with that, because it's not easy to change the way we've been doing business for many years and then incorporate this new concept in to an organization. And I always tell people, sometimes I used to tell my staff certain things over and over and over, and then finally I'd say, you know what, I'm calling one of my old buddies at BU, or I'm calling somebody from the field, and I'm going to say, we're having a guest speaker, and they're going to say exactly what I did, but you're all going to believe it better. And so sometimes hearing something from an outside person sometimes helps, and I'm more than happy to help in any way I can with that. Knowing how to leverage your data is important. Here's some ideas around it. Obviously, having outcome-based data, value-based information are important. When you go and market yourself and you tell stories, make sure all of those stories are data-backed up. When you go to a managed care company, they like to hear the anecdotal story. They respond, though, to the data. They are the ultimate in data-based decision people, and to really touch upon them, you need to touch upon them with information. I'm not going to go through this other than to share with you this slide, but this is the workforce piece I talked about. Workforce needs to have a new set of skills. There's a new culture that we live by now, whereas before data wasn't all that important. Now, when you hire a staff or when you do staff development, information needs to be critical at that, and people have to adapt. I've probably never seen so many people leaving certain areas of healthcare because they just didn't want to change than I have recently. And being a staff person and not being willing to adapt just doesn't work anymore. So, really look at staff that have that ability to adapt and help them with that adaptation. Yeah, I'll leave you with, go ahead, Frank.
I just wanted to jump in there on the skill set piece. We're finding that as we standardize these processes with our health record, it's also helping us to train our staff better and improve their skill set, because we incorporate other, with the use of the EHR, we incorporate other things. We have an intranet. If somebody's having an issue filling out something on our EHR, our intranet is a training resource to help them improve their documentation and improve the workforce knowledge of what they're doing. And so having this system available 24/7 to folks makes that a lot easier, so that staff can kind of teach themselves and supervise, kind of provide their own education to make engage them more in their work and do a better job.
Great point. Thanks, Frank. I know we're up against our time. This usually is more of a hour and a half, so I know I condensed it. I spoke fast. Frank spoke fast. Again, I encourage you to reach out and talk to us about this. We do a number of webinars. I do one at least once a month, usually 2 on different topics, and encourage you to join at any time. But this is something I leave with every piece I do, which is really around, remember to incorporate a culture of accountability in what you do. It's everybody's responsibility. Really be person-centered and concurrent in your documentation approach. I didn't talk about concurrent documentation today. It's something I believe strongly in and really feel the benefits are so significant. Don't lose your culture. You're important who you are. Enhance your operations constantly and really start to look at yourself against an ideal, while at the same time retaining or maintaining or incorporating a value-based mentality into what you do. I thank everybody for their time today. I know it's very difficult to take time out of your day in the middle of a afternoon to spend, but I hope that you were able to get something out of this. This is Frank and my contact information. I know I'll speak for Frank here that, if you have questions, please feel free to reach out. I love to have feedback. I love to converse with people around this topic, and as you'll probably learn from me, any topic. I like a lot of different areas, but please, thank you very much for your time, and jot this down. But Natalie, we're going to be sending these out to folks, right? So they'll have this information at their fingertips?
Yeah. Mm-hmm.
Okay. So thank you, everyone. I appreciate PRA helping sponsor this and everyone that was involved in pulling it together. Thanks, Natalie. Thanks, Frank. Thanks, everyone.
Thank you.
Thanks, guys.